Hey guys, this is Dr. Ellen from Ried Physical Therapy. So what exactly is tennis elbow and how do we take care of it? So first of all, tennis elbow is the layman's term for what a physical therapist or another healthcare professional would call lateral epicondylitis. And it's basically irritation, maybe more chronic irritation or tendinopathy, or even an acute injury to the muscles on the outside or the muscles on the back of your arm that connect to the outside of your elbows. That would be this large muscle group right there, and usually the pain is on the outside here, right on the outside of the elbow, where it gets kind of bony. Fact of the matter is this muscle group here plays a big role in several things. They do a lot of wrist extension, play a big role in grasping objects, a big role in elbow extension. So when you play a sport like tennis that requires gripping a racket, chronic wrist movements, chronic elbow movements, you're more likely to develop lateral epicondylitis, and that's likely why it's called tennis elbow, because tennis is almost the perfect activity to develop this kind of injury. So in physical therapy, what we do to treat it is, one, you want to get all the acute injury, any inflammation, any pain, you want to get all of that down, kind of calm the muscle down. And then after that, a series of stretches and then appropriately graded exercises to match what your elbow can handle in order to strengthen it, create stability in there, and really ensure that you can return to the activities you want to do.